I don't think there's a need to change your appearance. Frequently I have this conversation, patients come in and they say, what do I need to do? And I tell them, you don't need to do anything. You look great. You you can choose to do something if you'd like. All of these are options. And it's really about sorting through what will make you feel better about yourself right now. What's going to make you feel more confident? Is your goal to try to be 20 years younger? That's not really possible. And for a lot of people, they don't even want that. They don't want to be 20 years younger. They like where they are in life. They like all of their battle scars. They like where they've gotten today. And it's about making them just feel better. I just want to feel better. And that's really the goal of aesthetic surgery. It's not a constant pursuit of youth or beauty. It's about making people feel better.
Welcome to A Beautiful Fix. I'm Tracy Hill. Each week we'll dive into the latest thought gem, recharging and reconnecting with what lights you up and makes you feel alive. Let's discover your next beautiful fix together. Hey, real quick before we dive in, you're powerful. And sometimes you just need someone to remind you what's already in you. That's what human design does. It's the difference between guessing and knowing. So you can stop searching outside yourself and start trusting the answers within. I promise you they're there. Grab your free chart at abeautifulfix.com, and when you're ready to go deeper, book a one-to-one session with me. All right, let's get into the episode. Today's guest is Dr. Michael Brandt, facial plastic surgeon and founder of Form, Face, and Body in Toronto. Dr. Brandt believes aesthetic medicine should never be about chasing perfection. It should be about helping people look like themselves, only rested and refreshed. His approach emphasizes safety, education, and thoughtful decision-making, often reminding patients that sometimes the right answer is to do nothing at all. Today, we're exploring the world of aesthetic medicine through the questions so many women might be wondering: what are my options? What's the difference between them? And how do I make decisions that feel right for me? Dr. Brandt is also a 2-4 sacral manifesting generator and human design. Manifesting generators often have multiple interests, naturally look for more efficient ways of doing things, and aren't afraid to pivot when something better comes along. Dr. Brandt, welcome to A Beautiful Fix.
Thank you so much for having me. I'm really excited for today's conversation.
Too, and this is not intimidating at all. It's not intimidating at all sitting across from a plastic surgeon. Please, just no judgments, no judgments. But
Never
honestly,
any judgment.
okay. I'm honestly, I'm glad we're having this conversation because I think a lot of women are curious about cosmetic procedures, but it can feel overwhelming, intimidating, scary. There's so many procedures nowadays, there's so many opinions, and there's so much information online that it's hard to know what's real, what's just marketing, and what might actually be right for you. So my goal today, it isn't to convince anyone to do anything. It's just simply to help us become more informed so we can make decisions from a place of knowledge instead of confusion. So let's start here. I am completely a virgin to this world. I have never done anything, no Botox, no fillers, you probably can tell. And there's no judgment with that statement because I have friends that do a little bit of all of it, and I can see a difference. And I think that women should do whatever is going to make them feel confident, to feel beautiful, to enjoy this life we're in. So either way, I have no judgment. But for me, I've just never done it because I'm a little afraid of it. I don't completely understand it. The idea of any of it, I love the idea of feeling refreshed, and it's hard to age. It really is. It's something that, you look in the mirror and you don't recognize yourself anymore. So I totally get it. So I would just love to, unpack this a little bit. But let's start with, I use the term when I introduce you, aesthetic medicine. Can you help us understand what that is? Is that the same as plastic surgery, or is that something different?
So, in general, plastic surgery does a variety of different things. I mean, component of plastic surgery is purely functional. For example, you had a burn or you had some facial trauma or trauma to other extremities of your body, then certainly in the field of plastic surgery, then that's all part of it. As a facial plastic surgeon, I'm trained as a otolaryngologist or head and neck surgeon primarily, and then one of the subspecialties is facial plastic surgery, and that's sort of what I do. So I guess I'm an expert on everything head and neck related, and specifically focused on facial plastics. And then within that realm, I do some functional surgery, so reconstruction after skin cancer, fixing scars, helping with hair restoration, a lot of functional aspects. But then there's also the world of aesthetics, which drives us today, which is just making you feel and look your best. And a lot of the times, our outward sort of expression of ourselves doesn't match sort of how we feel on the inside. And sometimes through aesthetic treatments, we can really marry those two together.
Why do most people come to you? It sounds like you do a range of things, but is there one thing in particular that most women come to you for?
Yeah, it's really that mismatch. I don't feel or I don't look how I feel. Or I have friends who, look better than I do. They look more rested. People are commenting on the fact that I'm just not looking as rested as I used to. A lot of that really drives the consultation. And just to touch on one of the points you raised earlier, the reality is that the consultation is really a no judgment zone. We're not trying to sell anything in particular. I mean, if your consultant is trying to sell you something in particular, then they're not really doing their job. Their job is to explore and understand sort of what brought you in, where your concerns lie, and then quite frequently we can align that with options that exist in the marketplace and within our practice.
Do you ever turn people away? Like, is there a certain kind of person that comes to you that maybe they're doing this for the wrong reason, or that they should explore other things before they come see you?
Absolutely. You touched on a really critical point. So anybody going through a serious life change, a big breakup, a loss of job, where they feel like they're looking to do something with their appearance because they have a secondary gain with that change. I mean, that's not the right time to be looking to do a major sort of intervention. Really, you have to take some time, get comfortable with yourself, and sort of do some soul searching before you come in during that critical window.
So when is the right time? I was curious as I was just thinking about this conversation. Is there a certain age? To your point, is there a certain time in your life where it is a healthy decision to be considering these types of procedures?
Yeah, I guess anytime you're really bothered by something, and some of our patients come in and they're like, you know what, I've been bothered by my neck for the last 30 years. I want to do something about it now. Now that I have some time to be able to recover, I have the resources available to me, now is the time to do it. So it's really about what bothers you. I mean, to some extent, some of it is preventative, but some of it, or a lot of it, is about making you feel more confident and better about yourself so that you can engage with life more thoroughly.
So can you walk us through some of the different options that exist today? So for me on social media, the algorithm is good. They must know my age, because I'm getting all kinds of videos of women that are having these amazing, really natural looking transformations. But I don't understand the difference between like a mini facelift, a traditional facelift, and what they call a deep plane facelift.
So, I mean, if we're talking specifically about facelifts, a lot of the sort of taxonomy to some extent can be commercialization. So people come up with unique sort of framing to describe a surgery or technique so that they can sell it and consumerize it a little bit. So that's part of it. I mean, to take a step back, facelifts are an anatomic procedure. We're really moving the structure of the face. We're not treating the skin per se, we're lifting that structure. We're helping primarily with the nasolabial folds, we're helping with the jowl, we're improving all of that, and we're really treating the neck. And the neck, for a lot of people, is really sort of the real part that ages them, so to speak. And that's really where the facelift focuses. It's on that lower face. And within there, you have different ways of achieving the overall result. The new en vogue treatment, which is sort of, anytime you want to know a new procedure, open an old book. Deep plane facelifts have been around for a long time. Yes, there are nuances and the technique has dramatically improved of late. But what that means is that we're going deeper within the structures of the face to really reposition sort of the musculature and everything else, as opposed to just treating the skin, for example, or doing a less involved facelift. That being said, less involved, non-deep plane facelifts have been around for many, many years, and they can achieve great results as well. And one of those techniques is called a application facelift, where really we're getting down to the saran wrap that sort of covers the muscles, and we're folding it upon itself and suturing it together and lifting things up that way. Another way is to incise or imbricate that same layer called the SMAS layer, which is the saran wrap around the muscle. We make a small incision, we sort of dissect a little further forward, lift that up and bring that back. Whereas the deep plane goes much further forward and is a little bit more of an involved procedure. But it all deals with that saran wrap SMAS layer that allows us to really lift those tissues and reposition them so that you get an enduring long-term result.
You say saran wrap, are you referring to and I'm going to mispronounce this, but the fascia,
Yeah, so the fascia is a component, absolutely. So the SMAS layer, basically is almost like a connective tissue layer that covers over top of the muscle, and it is one of these fascial layers that has a little bit of tensile strength to it and allows us to really lift and move the tissues over and reposition them in a long-term way.
And do you, and you probably can't speculate, so please let me know if this is not the right question to ask, but I have seen so many celebrities of kind of recent that have had some really nice work done that to me looks completely natural. They look like they're just 20 years younger. Do you know what they're doing, or is that impossible to say?
So some of them I know. I happen to know some of their surgeons, so I happen to know a little bit about sort of what was done in different procedures. But yes, for a lot of these people who really want an enduring facelift, a deep plane facelift frequently makes sense. But it's all based to some extent on the risk tolerance of the patient. So we have a discussion about that in our office. Some people are much more risk averse. So if you start talking about dissecting over top of muscles and potentially injuring nerves and other things, they don't want to have anything to do with that. They want to keep things simple. They don't need a facelift that endures as long as possible. They want to look better than they do right now, and they want something that is ultimately the safest way of getting there without any undue extra risk. So there's always a balance of risk and benefit and a discussion around there.
So, Dr. Brandt, what is that you just described? What is the safest, maybe least invasive procedure? Is there one, or is it?
There is one. Doing absolutely nothing is always the safest. So, every procedure carries risk, just like getting in a car and driving into work or going to the mall or riding on an airplane. Each one of these things carries some degree of risk. Thankfully, the risks of surgery have dramatically reduced. They're low, but there are still some risks that exist with any sort of intervention. So if you are super duper risk averse, then maybe surgery is not the right thing for you, and maybe looking at non-invasive treatments might be a little bit better. Non-invasive does not mean risk-free. It's just a different risk profile.
What is there anything in particular that gives people more natural looking results today? maybe besides what we've talked about? Or are there things that we're just not aware of that we could do?
I mean, I think the end of the day discussion relative to natural results is picking the right surgeon, picking the right clinic. You really want a clinic that basically matches your aesthetic and how you feel, and looking at before and after photos, seeing the people who work there, meeting with your surgeon, talking with them, and ensuring that there's a great alignment there between sort of your expectations of results and what they frequently deliver. I mean, the biggest challenge, or the analogy I use with patients is, you don't go to an Italian restaurant and start asking them to make Chinese food, right? It just doesn't make any sense. What you want to do is focus on what they do best and look at their before and afters, make sure that their style and character and everything else aligns with you. While there are certainly, when we do surgery, we can customize it to some extent, but the basics of the procedure, the fundamentals remain very similar. And there's always each individual surgeon's aesthetics and what they deem to be beautiful and what they deem to be natural. And it's just making sure that you align with your surgeon, and that will ensure a great result.
So you mentioned that you focus primarily on the face and the neck. Do you have a specialty within that? Is out of the things that we've talked about today, is there something that you're kind of known for that people go to you for in particular?
Yeah, so I mean, a component of that is certainly facelift, is part of it. I do upper eyelid lifts, lower eyelid lifts, and then one unique procedure that I do is something called a nonsurgical rhinoplasty, where we use fillers to help reshape the nose and make it look better. Primarily from a side or profile view, you can help people really refine their nose without any surgical intervention in about 15 minutes.
And how long do fillers last?
Fillers in the nose can last well over a year, and in fact, after several treatments, it can almost be permanent. It's just the nose doesn't move very much. Fillers are retained in that area really well, but in general, fillers have really become much more long-term solutions, and each filler company has their own sort of individual sort of duration of effect. But what we now know through MRI studies and long-term sort of investigations is that these fillers never truly go away. Fillers are in, but what you notice is that you're not really seeing their effect. So they shrink down to 20 to 30% of what they were originally. But if you're constantly getting treated, that 20 to 30% really builds up. And that's when you end up with sort of challenges looking very sort of pillowy or unnatural, is that your filler is just being retained more and more and more, and people are just topping up.
It's the body. You think about the body, the way it's built. My limited understanding is that anything foreign, it tries to go in and say, oh, this is like a foreign body, and send histamines or what. How does it react to having something as foreign as like a filler? Does it try to clear that out, or?
To some extent. I mean, most of the time filler is manufactured of hyaluronic acid. There's other types of filler, but hyaluronic acid is the most common, it's the safest, and it very much is similar to what we have organically in our body, like in our joints and in other areas of our body. So while it's still a foreign body, and there's still always the potential for a foreign body reaction where your body tries to circle it and encapsulate it and try to sort of kill it, so to speak, most of the time it integrates within your tissue, and then over time it basically turns into water, and your body just simply dissolves it away.
Okay. Is these type of cosmetic procedures, is it addictive?
Like anything else, I mean, theoretically, it's addictive in the sense that once you've sort of overcome the initial risk profile and your understanding of what something involves and the fear of going through that process is gone, then now you're much more open to considering different things and different treatments. Kind of like riding your first roller coaster. The first one is the scariest. And then beyond that, it just, things change within the roller coaster spectrum. But it's really the biggest barrier is that first one. Same thing with, any of the injectable treatments. When you've gotten over that first treatment, then now all of a sudden all these options are available to you, and some people utilize those options more than others. The most critical point of that, though, is to find a scrupulous provider who's not there simply to sell you a whole bunch of filler or neuromodulators like Botox or Dysport or anything that you don't really need. It's a marriage in a long-term relationship with that provider. And really, in our clinic, I turn patients away all the time and tell them, you know what, you're not ready yet. If we add more filler now, you're going to start looking unnatural. You're going to look weird. We don't want to do that. We want to keep you looking your best. Let's see you back in about 6 months and we can revisit things.
That's wonderful because you see so many people out there that, again, look amazing, and other people where clearly someone has, let them go way too far. So that's nice to hear that you do that. So I asked on social media yesterday, just, if people had questions, and got some really interesting questions, and you've covered a lot. But one came in this morning, and I loved it. It was, does melanated skin present any special challenges to the procedures or healing?
That's a great question. Absolutely. So it impacts a variety of different things. Most specifically, it impacts energy-based treatment. So when we start talking about laser resurfacing, for example, we have to be much more we have to be much more cautious with melanated skin because there's a true risk of something called post-inflammatory hyperpigmentation, PIH, where the skin itself becomes darker in the areas that were treated. And then it takes a long time for that to settle and recover. In very rare instances, it can theoretically be permanent, so we have to be careful. And there's also a risk, theoretically, of bleaching the skin as well with interventions. And a lot of people notice this around scars on their body. You may have had a initial injury or something, and the scar that forms is temporarily darker than the surrounding skin, and then it takes a long time to lighten up. And if it's really sun exposed, then sometimes it could be bleached relative to the other skin, and that makes it much more obvious. So there is a little bit of a balance that has to be had when we're considering those aesthetic treatments.
That's so interesting because I recently heard that even sometimes facials are not meant for melanated skin. I never really knew that, some of the things, because I know women that do the chemical peels and all of, that. And for me, I feel like I don't know what I should be doing. I don't do any of it. And I do, worry a little bit. Am I going to get into my 60s and 70s and, regret it? But what are your thoughts on the chemical pills and things like that?
So chemical peels sort of predated laser resurfacing. They've been around for a really long time, and they predated sort of energy-based technologies. Frequently, they do an amazing job, and there's different sort of spectrums of intensity relative to those chemical peels. Some are much more damaging than others. They go deeper, and they can allow for greater resurfacing of the skin. Like really what you're trying to do is damage that top layer of skin, so make it go away so that you can regrow sort of the skin from the deeper aspect of it. And it's the same sort of principle as laser resurfacing. You're removing or vaporizing the upper layer of the skin and hoping that things regrow from there. So the challenge in that respect is just pairing the right treatment to the patient's goals. And if they are melanated, then you have to sort of take that into account when you're planning. But these days there are a lot of options and technologies that can match that individual patient profile and their desired goals.
Okay. And going back to the melanated question, are there certain things that we should be that are more for us that really work well on melanated skin?
There's a variety. I mean, in general, while melanated skin has higher risks of in certain things like scarring and other treatments, and we have to sort of weigh that in our decision making. As far as the specific options that exist, there's nothing in particular that works better per se on melanated skin versus not, or less melanated skin, so to speak. It's just really the fundamental difference is the risk profile. And in general, if we're starting out on treatments, then the basic stuff still remains basic and still works. Sunscreen, the sun is the biggest ager of people's skin. So if you can use some sunscreen, that'll prevent a lot of aging. Even in patients who are melanated, who don't typically use as much sunscreen, I think it's very important. Aside from that, some form of moisturizer for the skin. And then the third piece is to use something like a retinol or retinoic acid to turn over those cells faster, just to sort of rebuild them and replenish things. And those three treatments together occupy the lion's share of sort of a basic treatment protocol.
I'm forgetting the name. It starts with a T. It might be a form of retinol.
Yeah, it's probably tretinoin or one of those. Yeah,
Yes.
they're all part of that same family, all part of that vitamin A type treatment, and they just really improve skin cell turnover and can really make the skin look better and brighter. Now, this isn't something that works immediately. It requires sort of a long-term outlook, but after several months of treatment, it really can work nicely.
Okay. What about the infrared mask that you see all around? I see them everywhere on social media. Or do they really do anything?
They can help a little bit. Again, what they do is they increase vascularity, blood vessels sort of coming towards the surface of the skin. They increase circulation around the skin. It can help flush, toxins and other stuff, and work almost like an antioxidant a little bit towards the skin. And there's emerging evidence that using them for 20 to 30 minutes 3 times a week can be beneficial. Certainly for the hair loss patient, using them to help with hair loss can work as well, combined with usually other modalities in that particular client group. But for general sort of aesthetic well-being, everything helps. Is it going to be a panacea for all that ails you? Probably not. Is it going to give you facelift results? No. But if you're somebody who wants to optimize things, it's a great choice.
Are there any risk with infrared mask?
Not really. I mean, just ensuring you're getting a good quality mask, the risk, the risk ratio or the potential for adverse effects is very, very low with those devices.
And is it one of those things where as long as you use it, you're seeing the results, but the moment you stop, it's going to also stop?
Yeah, to some extent. I mean, it's like anything else. You're going to be using these things and you're going to get improvement from them all. If you stop, then you're back to sort of, just aging gracefully. And it's not like you've just turned things off. There's going to be sort of, deterioration over time, so to speak.
Okay. One of the big questions that came up was women wanted to know about the neck, what you can do about the neck. So I guess I have with everything, I would love to know like the preventative thing that we can do, and then what should we do, or what do you do if you are to the point where you want to surgically have something done?
Yeah, so, prevention-wise, moisturizers and sunscreen. I can't overemphasize the importance of sunscreen. A lot of the wrinkling you see on people's neck is because of sun exposure. So if you can make that better, that's great. Avoiding smoking also helps with skin in general. So those two things are critical. Once the horse is out of the barn, so to speak, and we're really trying to improve things, then now we really have to look at different options. If you have sort of structural problems where, for example, you have a lot of loose skin in that area, a bit of a turkey neck type idea, you really want to get rid of that, then really the only option that works well is a surgical option. There are devices and technologies. Most of them are over-promising and under-delivering relative to those treatments. And the best option usually is a neck lift or bringing that skin back. Quite often we combine with a facelift because if things are loose here, they're usually loose over here as well. And we have to reposition all that tissue and improve it. That helps with the structural issue. But the skin quality itself frequently requires other treatments. That's where some of those energy-based technologies like lasers or even chemical peels or other things can really help to resurface and stimulate sort of improvement in collagen in the skin.
So are there two different kinds of facelift? You mentioned like do some people do just a lower facelift and some do an upper facelift and some do the whole facelift, or is it all one thing?
Yeah, so facelift is a bit of a misnomer in the sense that people assume that a facelift includes eyelids, brows, forehead, things like that. But really, a facelift is very much a lower face procedure. It really focuses on the jowls and these nasolabial folds and primarily on the neck. It really repositions all those tissues. A brow lift or forehead lift is a separate operation, as are procedures around the eyes to restore sort of the opening of the eye, removing excess skin or helping with fat pads underneath the eye. For example, each of those are a separate procedure. Sometimes we'll combine them into one big operation for that day, or sometimes we'll break it up and we'll treat things independently.
You just remind me of a couple of other questions people had. One was around droopy eyelids, and another one was around filling the lips.
So we can start with the droopy eyelids. So droopy eyelids is a variety of different things. If one eyelid sits lower than the other, as far as the opening of the eyelid, one covers more of the pupil than the other, then that's a medical condition. That's called ptosis, Ptosis. And that's actually a medical problem or a surgical problem of how the muscles insert into sort of the edge of the eyelid. And that requires frequently a surgery to correct that and balance the two eyes out. If we're talking about sort of drooping of the upper eyelid skin, this skin underneath the brow and the upper eyelid skin, then that's an upper eyelid lift, or we call that a blepharoplasty, an upper blepharoplasty, and that's typically to remove some of that excess skin. We could also do some interventions on some of the fat in that area as well, if that's necessary. But these days, contemporary upper eyelid surgery really tries to preserve some of that volume in that area, because volume theoretically is youth in that area. Preserve that. As far as lower eyelids, those procedures can be done in a variety of different ways, and that can address some of the excess fat or sort of the eye bags underneath the eye. Again, that's called a blepharoplasty or a lower blepharoplasty, and that allows us to address those fat bags, and then we can also address the skin separately. If there's excess wrinkling or excess tissue in the lower eyelid, we can address that as well. So the individual treatment plan really is specific and catered to the patient and what in particular their anatomy presents and what we're trying to improve upon. The main thing I would state relative to, certainly lower eyelids is a lot of the times if it's truly an anatomic problem, there's no non-surgical way to fix that, to hide the bags or other things. Sometimes people advocate using fillers to try to treat sort of tear troughs or eye bags or things like that. And that's when you run into problems. There's really, a very narrow indication for lower eyelid fillers to really keep them looking good. And it's important in general, what I usually advocate to patients is to make sure your provider has a very full toolbox in the sense that they do filler treatments and non-surgical treatments and other things as well as surgery. So they're not trying to pigeonhole you into what they have on their shelf to offer you. And that's usually the safest situation and the situation where they're going to give you the absolute best advice.
And
I
then
didn't answer the lip question, but yeah.
Yes, so lips.
So relative to lips, these days we try to keep things a little more natural. For a little while there, lips were going kind of crazy and people were getting them overfilled and they looked absolutely bizarre. Thank God that whole situation has changed a little bit. In the right patient, there's a variety of things we can do around the lips by using, gentle volume in that area, make them look a little more hydrated, make them look a little less wrinkled, make them look a little more voluminous. And as long as we're sort of using our judgment and we're being sort of a little more scrupulous about it, then we can keep people looking absolutely their best and keep them looking natural.
Yeah, because are women getting their lips filled to just, as you mentioned, bring them back to maybe their more youthful appearance where they're a little bit more plump, or are they getting lip fillers to have fuller lips than they've ever really had?
I think both are real. So, we do see older patients with thinner lips over time. We lose volume everywhere in our body over time and we can't fight gravity. And they're coming in and they just want to restore things a little bit. They want more hydration. bring back a little bit of volume, and that's certainly one group of clientele. And there are, the separate group of clientele are people who just want more volume, and they've always had smaller lips and they just like them to look a little bit more full, a little bit better. But there is, a tipping point in there where you've started to treat it and they are looking better and they're looking natural. And some people want to look alienized or bizarre. And in those circumstances, frequently I will tell them, I'm sorry, that's just not sort of my aesthetic. It's not something that I really want to do to you. So, there's other providers if that's really what you're after. And people will find, I guess, the provider that fits their aesthetic, and they may go from there. But it's not something I usually advocate.
So what happens after you fill your lips and you have these, voluptuous lips and the filler starts to recede? Doesn't it make the problem worse? Doesn't it make them more saggy or
Thankfully, tissue
stretchy?
rebounds. Yeah, thankfully,
Okay.
tissue rebounds, and over time it can go back. I mean, certainly, if you've expanded tissue enough, it can be permanent. And if you're adding a ton of filler in your lips over time, yeah, if you choose one day to dissolve it away, or you just leave it alone, then you may end up with some extra redundancy of the tissue. That's certainly possible.
Preventively, if we can go back to that. Can we talk a little bit about nutrition? I am a sugar addict. I'm not proud of it, but I absolutely am. And I've heard that, we know sugar is horrible for you, but I've heard there's something called sugar face where it does, I don't know, horrible things. I don't know if it causes extra wrinkling, but are there, have you heard of that? Is this,
I'm not really familiar with that
okay,
term. Yeah,
okay.
I'm not sure. I mean, certainly sugars are bad. There's a lot of things that are bad for us in general. I think, some degree of moderation for everything is probably okay to some extent. But yeah, I mean, sugars feed bacteria. They're, oxidant producing. There's, problems from that perspective. We just have to be cognizant.
Okay. Botox was a big thing, big question that people had. And one person was saying, Botox is so expensive. Why is that? Especially when you need, they were mentioning 40 to 50 units for a forehead, which I was blown away by that.
Yeah.
But thoughts on that?
So the number of units that are necessary for each individual patient is unique to that individual patient. We have guys coming in like myself. If I'm treating myself with neuromodulators, I need a lot. I have very robust muscles that need a lot of units to get them to stop moving. Other people can require very little and get sort of a great result. In our particular clinic, we don't charge by the unit, we charge by the area to be treated because, when you're filling up a car, you want a full tank. You don't care how many liters were required to get there. And that's really sort of, or gallons were required to get there. But really for us, it's about treating the area. And the goal of the treatment is to stop the muscle movement to prevent the wrinkle and help relax the wrinkle. So that's really the goal. So that's what we charge our patients for, is that goal. And that's what we endeavor to create. And some people will need more than others. And there's a balance there. There's a very delicate balance relative to too much neuromodulator at the forehead, for example, can really drop the brows and it can look very unusual. And the reason that happens is the forehead only has one elevator, one muscle that lifts it up, and that's the frontalis muscle. And if we knock that muscle out, all of the other muscles that help us frown and close our eyes and everything else take over and they pull the brows down and it looks unusual. So really there is a balance, and as we sort of progressively get a little bit older, what ends up happening is gravity. So the brows are down in general. So by treating the forehead, we unmask that. And then all of a sudden people come in and they're like, oh my God, my eyes look smaller, my brows are heavy. What's going on after my treatment? And it's basically you've aged and you've had too much neuromodulator at your forehead when really maybe you needed some other intervention up there, whether that's surgery or something else, to really help, make you look a little bit better.
You mentioned men? Do you have more men coming to see you?
Absolutely. Yeah, we get a lot of male clients coming in. They're similarly, I mean, it might be a little more smaller volume relative to prevention with the neuromodulators like Botox or Dysport. They want, the same thing women do. They want to look refreshed. They want to be active in the workplace. They want to look their best and present their best treatments. And it's people from all different scopes of life. It's not in an individual sort of pocket or patient population that comes in. Conversely, some of them want stronger looking jawlines where they'll get filler in that area. They're looking a little gaunt. They're very active. For example, we get a lot of runners coming in who are looking really, really thin and they want to look a little more volumized in their face because that's where they lose their fat first. And they want to look better in that area. Conversely, hair restoration is big for our male clientele as well.
Is there a time frame for Botox where if you haven't started by 50, it's not even worth it? Or the reverse, even if you have been doing it maybe since your 30s or 40s, if you stop at 50, does it all come back like you never did it in the first place? How does that work?
So there's a couple of different ways to look at it. So, for prevention, our treatment paradigm, when we see patients who really want prevention, they have no wrinkles on their forehead. They're coming in, they purely want some prevention. They vary in age. Some people will come in their late 20s even to start with that prevention. Some people can come in their 40s and they still look amazing, but they want some of that prevention. And in that circumstance, I usually advocate doing a treatment, once or twice a year as prevention, as opposed to really trying to treat things. When people come in with established lines or wrinkles, now we're in a different sort of treatment paradigm. Now we're really trying to treat those things. That's our goal, is to try to smooth out some of those lines and wrinkles. If they're really, really well established, then now we really have to look at all of our options that are available to us. Certainly there might be a role for neuromodulators to prevent things from getting worse and to stop the muscle action that's driving some of those lines, for example, the frown lines and things. But sometimes we have to move on and we need to consider laser resurfacing, for example, to really help soften some of those lines in the interim, kind of like, the bigger renovation before you start the upkeep.
Okay. So, Dr. Brandt, a question that I have for you is your thoughts on, women, there's so many things that women are challenged with in today's society, the never-ending pursuit of being young, and more women are standing up and saying aging is beautiful and it's a gift. I have friends that, passed in high school, and I always think about them and try to carry them with me when I'm trying to make life so too serious. I think about them, that they never had this chance to get to level 56. That's what I call, I'm at level 56. What are your thoughts? Do you feel any responsibility towards adding to that narrative that it's not okay to age or that we need to change our appearance? I'm just curious.
So I don't think there's a need to change your appearance. Frequently I have this conversation, patients come in and they say, what do I need to do? And I tell them, you don't need to do anything. You look great. You can choose to do something if you'd like. All of these are options. And it's really about sorting through what will make you feel better about yourself right now. What's going to make you feel more confident? What's your goal? Is your goal to try to be 20 years younger? That's not really possible, so to speak. And for a lot of people, they don't even want that. They don't want to be 20 years younger. They like where they are in life. They like all of their battle scars. They like where they've gotten today. And it's about making them just feel better. I just want to feel better. I want to be a little less wrinkly. I want to be able to put on my makeup and not be frustrated by these like barcode lines on my upper lip or what have you. I just want to feel better about myself. And that's really the goal of aesthetic surgery is, I joke about this, but it's surgical psychiatry, right? We are able to do surgery to restore people's self-confidence and make them feel better about themselves. And that's the actual goal of these procedures. It's not a constant pursuit of youth or beauty. It's about making people feel better.
Well, Dr. Brandt, when I was looking at your human design, are you familiar with human design at all?
I'm not. I did the test. I saw the results. I will confess I plugged them into ChatGPT to see what it said about me, and you
Yes.
sort of summarized it at the outset. I'm like, wow, that's kind of insightful, actually, just based on a birthday. That's pretty cool.
It's eerie how accurate it can be. So I mentioned in the introduction you are what they call a 2-4 sacral manifesting generator. And just to kind of unpack that a little bit, so a manifesting generator, they're these amazing energetic types that can kind of do it all. They're really good at multitasking, multiple interests, doing it all at once, pivoting a lot. They may start things and not necessarily finish them, but that's kind of the goal. It's kind of how they're built because it leads them to the next thing. They're very efficient. A lot of times they can um, not cut corners, but they can reduce steps. Something that might take me 6 steps, they're like, you know what, I can do that in 3. And then you have sacral authority. So that's how you're aligned to make decisions for yourself. So sacral authority is one of my favorites because in the moment, your body speaks to you. So if you feel this guttural reaction to something, like you feel your body, your shoulders move, like, ooh, your body's saying you have energy for that, and you can trust it in the moment. Now, an hour later, you may feel differently, but in the moment, that is truth for you. And the 2-4 portion is your profile, which is this really complex um, profile because the 2 is very natural. There's something that they're normally naturally gifted at that sometimes they can't even see in their earlier years. Other people, a lot of times, have to pull it out. Like, you know what, you're really good at X. And you think, oh, I just do that naturally. 2s are also a little bit of a hermit type. Doesn't mean that they don't like people or being around people or being social, but alone time is crucial. Like it is a non-negotiable with line 2s. It's something that it's great to just tell your family, hey, when I need to just kind of disappear for a second, don't take it personally because during that alone time is where you really hone those skills. Those magical natural abilities, they come to you and they come together when you're in that alone time. But it's something you have to really protect with your energy. But then the 4, it's all about connections. So you've got this really interesting, dichotomy between the 2 needing its alone time and the 4 is it's about relationships. It doesn't necessarily mean that I'm a line 4, that you are this networker where you're out talking to everybody, but your relationships are gold. Your opportunities are going to come from your network, from the people that you know. So does any of that kind of resonate with you?
All of it. Yeah, it's kind of scary how accurate these things are, I guess. But yeah, I mean, in general, I'm pretty introverted. I do need sort of my alone time. I need time to sort of be by myself and process. I mean, part of it is I'm an only child, so I'm sort of used to that, and
Yes.
that that's what I'm sort of that's where I sort of thrive to some extent. I joke with my wife that we watch these shows like Alone or these people are dropped off in some deserted island, and I'd be like, that'd actually be pretty cool for a little while. I think I could
Same.
enjoy that.
Yes.
As far as the other parts to it, yeah, I mean, when I was a kid, I loved Lego. My son loves Lego now, and quite frequently, I didn't look at the instructions. I just figured out how to put it together by myself in order to sort of, and I would do that to do it in a more expedient way. And certainly, when I look at sort of surgery or other interventions that we're doing, I am looking for ways to refine steps to make them more efficacious, decrease risk, constantly refining procedures and making them better. And I think all surgeons do that to some extent. I wouldn't want to go to a surgeon who doesn't do that. We're all
Yes.
trying to constantly be better. So I do think it's sort of a unique way of characterizing things. It's very cool.
I love it. Well, before I move on to the last part, is there anything that we haven't discussed or covered that you would love for people to know about this whole world of aesthetic procedures?
Yeah, I think the main thing is if you're considering a change or considering sort of aesthetics, I think the most important thing is to have a conversation with qualified provider. Look them up. You can use your friends as references. You can find different people. And then once you've had that conversation, have another one. go see more than one person. You know, people who come in and they're like, you know what, I don't want to get a second opinion. I'm all, you know, about let's just do this. I mean, that's great. I'm glad you're gung ho. But the thing is, though, is that a lot of the times people dismiss how big some of these interventions are. You know, surgery is a big deal in general. It's important to make sure you're aligned with the person who's operating on you, make sure you're comfortable with them, make sure that all your goals are set. And I think it's just important that if we're considering any of these things, to talk to qualified people and get extra opinions. And that will ensure that you're really getting what you're paying for, you're really getting what your expectation is.
Wonderful. Thank you. Well, something I've started this year are these little love notes that I pass along from one guest to the next. And my last guest was Christy Halverson. She's the author of Perfect Unfolding, which was a memoir inspired by her decision to leave her career as a firefighter and paramedic and spend 7 years traveling solo across North America in an Airstream. Remarkable story. So she wanted to pass this little note along. If you feel that subtle tug towards something unknown, that tickle of your soul urging you toward a life that makes no logical sense, trust it. What comes up for you when you hear that?
Yeah, I think it's taking risks and just, you know, going with your gut, as you said earlier, as far as the profile, right? Just, you know, working with that and moving forward and trying new things. I think, you know, one of the beauties of life is exploring different things and, you know, being comfortable, being uncomfortable to some extent.
Absolutely. Well, Dr. Brandt, what makes you come alive?
I guess, you know, to some extent work. I love what I do. I love the opportunities I have to help people. But really, you know, aside from work, it's really my family and my kids. They're the most important thing in my life and what I spend all my time thinking about and doing things for.
Love it. What's a song that instantly shifts your energy or makes you feel something?
Don't really have a individual song. I mean, I like all sorts of different musics and genres and really have eclectic taste relative to music, so nothing in particular.
It's probably one of the hardest questions, for sure. Well, how about a book? Is there something that just cracked you open or stayed with you long after you read the last page?
Yeah, I guess, you know, the most recent book I read that really sort of impacted me in a profound way was a book by Ellie Sharabi called Hostage. And this was, you know, it's a story of survival, unimaginable loss, courage, humanity, all of these things. I would encourage anybody to read it. And it's through his eyes and how he experienced, you know, being effectively a hostage. And it's really important to sort of share that story and understand sort of what happened to him.
Was it a true story?
It's a true story. Yeah.
Oof.
Yeah.
Okay. How about your favorite little indulgence or guilty pleasure?
Diet Coke. Love it. Can't have enough. It's really sad, but yeah.
No judgments.
Exactly.
One thing that always reminds you how beautiful life really is.
So it's, you know, to go back to my kids, it's watching them do something that they truly enjoy, something that they love, just seeing, you know, the smile on their face and being out there. I recall, you know, my eldest daughter went through COVID, and she's very much a athlete and social person, and she was sort of stuck indoors for a long time, only able to interact with her siblings, which is, you know, its own powder keg. But the first time I saw her really regain her personality and smile was playing soccer. And she just loved being out there, and just seeing that smile, seeing that raw, true joy is really what sort of fills my heart and really reminds me what, you know, is beautiful about life. And thankfully, each of my kids have their own individual outlets that really make them sort of smile and come alive and be happy. And I'm glad they do.
How old are your children?
I have a 14-year-old daughter, a 12-year-old son, and an 8-year-old daughter.
Wonderful. So where can listeners connect with you or just kind of be a part of your world and find out more about what you do?
Sure. You can follow me specifically on Instagram at DRMBrandt, BRANDT. You could follow us at Form, Face, and Body on Instagram, or check out our website, formfaceandbody.ca.
Perfect. We'll put that in the show notes. And then tell us a little bit about your guide, The Questions Worth Asking Any Aesthetic Consultation.
Yeah, it's just really a quick summary of things that you should consider when you're looking for any sort of aesthetic intervention. And it sort of is based on a lot of what we talked about today, just making sure that you are getting out of that sort of intervention or out of that consultation absolutely what your goals are.
Perfect. And we'll include that. I believe you sent me a link to that, so we will make sure that we include that in the show notes as well. Dr. Brandt, thank you so much for being here. This has been so informative. I had so many questions. I feel like I understand the world a little bit more. So I truly appreciate you being here. And friends, I hope today's conversation leaves you feeling informed and empowered and reminded that whatever you choose, the best decisions are the ones you make for yourself. And until next time, keep getting high on life, one beautiful fix at a time. Thank you.
Thanks so much.
Thanks for listening to A Beautiful Fix. If you enjoyed today's episode, be sure to subscribe and leave a quick review to help others find us. And if you'd like to share your own beautiful fix or join me as a guest, reach out anytime at Tracy@abeautifulfix.com. Looking forward to next time.